Finn Voices on the Healthcare Now radio, where we highlight and amplify the voices at the forefront of health innovation that improves people's lives. Join us for an inside look at the changemakers driving conversation and answering the most important questions in healthcare today. Thanks for joining us.
Hello, everyone, and thank you for tuning in. I'm your host, Beth Friedman, Senior Partner at Finn Partners. I'm based in Atlanta, and my guest today is Bobby Sepucha, CEO at Interwell Health. Today, we're talking with Bobby about how Interwell Health uses innovation to serve kidney care patients and also proactively prevent kidney failures. We're going to talk about better data, tighter care coordination, and really using that value-based approach. So, Bobby, I'm thrilled to have you on as a guest today on Finn Voices. Welcome to the show.
Thank you for having me.
Absolutely. Absolutely. Glad you're here. So first question, we'll do a little celebration to start with. I heard you all just celebrated your 1-year anniversary, so congratulations. And I thought we could start by telling our audience a little bit about how and why the three companies came together and maybe share some of your big accomplishments in kidney care over the past year.
Sure. Thank you again for having me and for the congratulations. It's been a heck of a year. Three companies came together last August to really try and reimagine kidney care. To put the scope of the challenge in perspective, kidney care is incredibly complex and it's a very expensive chronic condition. In fact, about 15% of Medicare beneficiaries have kidney disease or kidney failure, and they cost Medicare over $124 billion. That's one out of every $4 spent in Medicare. So Interwell came together to do more for these patients. We wanted to go upstream, identify them early before their kidneys have failed, and give them the tools, their support, the resources to take a more active role in their care. We also wanted to support their physicians, their kidney doctors. We wanted to be the connective tissue between the kidney doctors and dialysis centers and the other providers like primary care and cardiologists to help make it easier for patients to navigate the system. So we partner with private payers and the federal government to manage all of these patients' health needs. So by taking full clinical and financial accountability for this patient population, we can deliver better outcomes for the patients themselves and reduce the total cost of care for the payers. So in the last year, since we came together, we've added Acumen, which is a nephrology-specific EHR. It's the number one EHR used by nephrologists. We've signed a joint venture with Oak Street Health called Oakwell. That helps us bring primary care into the mix here. We've signed several new payer deals, including relationship with Providence Health Plan. We've launched in Puerto Rico. We've expanded our work with a very large national Medicare Advantage plan. And we've become the largest participant in the federal government's value-based kidney care program, which is called Kidney Care Choice. And none of this would have been possible without, our incredibly dedicated team of nurses, dietitians, social workers, and pharmacists, but also with a network of over 1,700 nephrologists across the country, which is the biggest network by far. So putting all of this together, we think we can do a heck of a lot more for kidney patients.
So, Bobby, congratulations again on the 1 year. I'm curious about bringing together the three companies. And so what was the inspiration behind that?
So the three companies that came together were Cricket Health, Fresenius Health Partners, which is a division of Fresenius, the large dialysis provider, and then a company called Interwell, which was a joint venture between a bunch of nephrologists across the country and Fresenius, trying to figure out how to do what were best practices in delivering value-based care to kidney patients. And as the three companies, we're all trying to get to the same place of doing more for patients. We came to the same conclusion, which is by coming together, we really were creating a complementary platform where we could finally touch patients wherever they were, at home, in the physician office, or for those who had progressed to dialysis in the dialysis clinic, and everywhere in between. Cricket brought a novel technology-based patient engagement platform where patients and clinicians could engage virtually, asynchronously, talk, text, video over our homegrown technology platform. Fresenius Health Partners brought a long history of delivering value-based care to the late-stage population. And again, Interwell brought that network of physicians that is so key to delivering improvements in care. So by bringing all of these things together, we think we've created the preeminent platform for value-based care in kidney.
I'd heard about the news last year when you guys all came together, and, it certainly makes sense by pulling together the components around this disease process, used to be pretty siloed. So it sounds like it's making a lot of sense. And I appreciate you giving us sort of the background as well as what you guys have been doing this past year. It sounds pretty exciting. What I didn't realize, and you just told us, was that 1 in every $4 spent on Medicare is spent on dialysis. I mean, that's pretty amazing, and I know once patients get into that stage, it is costly. I'll share with you, I had a great uncle, Uncle Jack, who was a kidney patient and ended up in dialysis. And whenever he would come visit me in Atlanta, I'm the one that took him and sat with him. And wow, it was so eye-opening. So I really do hear what you're saying and understand the just the difficulty that patients are with, or the stage they're at when they get to the dialysis point, right? So just like other chronic diseases, it sounds like those patients in kidney care that are most acute or really needing the dialysis, they're the ones that are most costly. So it's like that 20-80 rule that we always hear about. What's Interwell doing to sort of identify some of those, I'll say, rising risk patients before they get there? What are you guys doing to sort of preempt some of that?
Well, first of all, my heart goes out to your Uncle Jack and your entire family. It's this disease, a diagnosis of kidney disease is such just a radically impactful diagnosis. It can be shattering for a lot of patients and their families because it's life-changing. And if you're able to identify the patients early, if you're able to, again, give them the resources to take a more active role, you can slow progression and hopefully deliver better health outcomes. But you raise a really important point, and that is that even for a complex and expensive population like kidney patients, the 80-20 rule still applies. So in order to be successful, we need to be able to identify those patients who need the most help, that 20% that's going to be responsible for 80% of the cost. So it's really key for us to be able to identify who's most at risk to progress in their disease, who's most at risk to be hospitalized in the next 30 or 60 or 90 days. And it's especially hard with a condition like kidney disease that's so often under or undiagnosed because the symptoms don't appear until very late in the disease journey. There are 36 million Americans today living with kidney disease, but over 90% of them don't know that they're sick. That's the challenge we face. So we've developed some cutting-edge machine learning and predictive algorithms that can not only identify who has the disease, but predict with about a 96% accuracy what stage of the disease they're at. We've got some similar algorithms that help us identify, again, who's most at risk for hospitalization. So by doing that, by using these data tools, we're able to help our clinicians understand which patients need the most help and when they need it.
Sort of alerting them, because now you've got this big network of nephrologists that you're working with, right?
That's exactly right. If you think about a nephrologist's day-to-day practice, they wake up each and every morning having to work with all of their patients that are in the dialysis clinic, and they round with each dialysis patient. But then they also have to manage the late-stage chronic kidney disease population, the pre-dialysis population. And without good analytics, without good predictive algorithms, it's very hard for them to tell which patient really needs care today and which patient can be seen next month or even next year. That's what we're able to provide in terms of support for the physicians.
So love the data, love the use of data. Obviously, our show is about innovation, which brings technology into the picture. But for kidney patients and maybe even these other chronic conditions, what are we doing beyond technology? It's obviously never just the tech, right? So what else is Interwell doing that might be outside the scope of technology itself?
It's such a good question. As proud as we are about our analytics and our patient engagement technology, and believe me, we could go on all day about it, healthcare isn't just about data or tech. At the end of the day, healthcare is about clinicians putting hands on patients. It's about fostering that human connection, helping the nurse, the dietitian, the social worker unlock something with that patient so the patient can do more for themselves. It's about putting them on the path towards recovery or healing. Ultimately, I think it's about solving what I call the cookie problem. So what I mean by that is we have a patient, a gentleman who is in late stage. He has late stage chronic kidney disease. He's not yet on dialysis, but his kidney function is declining. And this gentleman loves his cookies. It's not exactly the most kidney friendly diet, but every single night, about 1 o'clock in the morning, he gets up, goes downstairs, has himself 4 chocolate chip cookies and a big glass of ice cold milk. We have been working with him for a little over a year now, and our nurses and our dietitians and social workers have been working with him to try and help him come to conclusions about how he may want to change his life, what goals he's aspiring towards. And after an awful lot of work and an awful lot of engagement, he was having a conversation with one of our dietitians and said, I've been thinking a lot. I'm thinking I could get down to 2 cookies. And our dietitian said, that's a fantastic idea. So after several more weeks and months of working with this gentleman, he's down to 1 cookie and a half a glass of milk. Now, ideally, clinically, we love to say no cookies ever. But you have to understand where the patients are, what's important to them. And for him, this nightly ritual is incredibly important. So again, it's not about the data. It's not about the technology. It's about using the power of that data and technology to provide meaningful insight to the clinicians at the point of care. They found that this gentleman was most at risk for progression and were able to engage with him. And it's taken a long time, but his A1C metrics are improving. His blood pressure is improving. So this is the long, slow slog of healthcare.
Absolutely. And one of the things that you mentioned, which I think is so important, we talked about nephrologists and being able to alert them. You mentioned all the other people on the care team. I mean, the dietitian, the care coordinators, the nurses. Certainly with these kind of complex conditions, all of those people are important stakeholders in trying to change patients' behavior, which is so hard, right? It's such a, like you said, it's the long slog of healthcare.
No question. And I think, our nurses, social workers, dietitians, pharmacists, they account for almost, I think, half of our employee population. They're incredibly important. It really does take a village. And your point about changing patient behavior is vitally important. And I think it gets lost an awful lot. Changing outcomes is about changing patient behavior. And you cannot change patient behavior unless and until you first fundamentally change the way in which you engage the patient at the outset. If you're able to do that, if you're able to use the cliche, meet the patient where they are, then you have a much better chance of helping them understand what changes are needed, why they're needed, and how they can make those changes impactful.
So meet the patient at 2 cookies versus forcing them to do yoga every day, right?
That's exactly right. You cannot let the perfect be the enemy of the good, as much as we'd all like to.
Exactly. I love that. You're listening to Finn Voices on Healthcare Now Radio, and my guest is Bobby Sepucha, CEO of Interwell Health. Bobby, I worked in a hospital for a long time. I actually was a medical record coder back in the day. So I'm familiar with kidney disease. I'm familiar with the progression of the treatments from a provider perspective. What I'm curious about, because in the beginning of our session here, you mentioned that you've also reached out and developed partnerships with health plans and payers. So tell me a little bit about the trends that you're seeing from health plans as it relates to, number 1, improving outcomes, but number 2, reducing costs, because we know that's all the name of the game when it comes to value-based care.
Yeah, it's a really good question. And I would have had a very different answer about 3 years ago. Then I would have said that health plans are doing really what this country has done far too long, which is only focusing on dialysis. And from the health plan's perspective, it was all about what they could do to reduce dialysis rate. But now, to their credit, I think they understand and they can see the big picture. They recognize that there's a lot more to the end stage population, the kidney failure population, than just dialysis. And indeed, there's a lot more to kidney disease than just that end stage population. They recognize that patients who progress quickly through stage 3, stage 4, stage 5, late stage chronic kidney disease, if they progress too quickly and aren't managed, they haven't managed their meds, they don't understand their treatment options, they're going to do what's called crashing into dialysis. They're going to show up at an ER with chest pains or blurred vision with no idea what's wrong, no idea that they have kidney disease. And they'll be given a blood test and be told by the ER doc that, hey, guess what? They have to have a catheter in their neck and they're going to be on dialysis that day and for the rest of their life. The plans see this now. They're starting to see how the whole picture fits together. And to their credit, they're trying to figure out how to do more for members across that full spectrum of the disease. And that's why they're partnering with people like Interwell. I think what they're also trying to figure out is how to bring the merits of value-based care to kidney, which is again, as we talked about, a really complex and expensive disease state. So working with them, we're able to do a couple of things. One, we're able to help them understand who their membership is. As we talked about earlier, we can use our predictive analytics to identify which of their members has the disease and what stage of the disease they're at. And then by taking full clinical and financial accountability for them, full risk, if you will, we're able to really do what they're hoping to do, which is keep their members healthy at home and out of the hospital. So it's a really interesting sort of inflection point for kidney disease. We're probably, I don't know, 4, 5, maybe 6 years behind primary care in terms of moving towards value. But with the help of the federal government, with their new Kidney Care Choice program, with help of Medicare Advantage plans, which are at the vanguard of moving towards value, I think we're pushing the entire disease state into more value-based approaches, which again is just delivering much better health outcomes to patients. And at the end of the day, that's what this is all about.
Absolutely. Being more proactive versus billing fee-for-service that we've all been stuck in for a long time.
Absolutely.
Now, you've mentioned twice a program that I'm not familiar with. So let's just take a minute to talk about, you mentioned the federal program, kidney care. I can't remember what you named it. Can you tell us a little bit about that?
Absolutely. It's called the Kidney Care Choice Program. So Medicare Advantage plans and even some commercial plans are starting to move to the kidney population towards value-based care. What the federal government has been grappling with is how do we bring the value and the benefits of value-based care to the Medicare fee-for-service population, and especially for the kidney population, which, as we talked about, is so expensive. So they've done a couple of different things. Several years ago, I'm going to get the years wrong, but call it 2014 or 15, they launched what was called the ESCO program, which was a shared savings program for the dialysis population only. It was, I think, one of the first, if not the first, disease-specific ACOs, if you will, accountable care organizations, where dialysis providers and nephrologists could come together and if they were able to do more for patients and improve their outcomes and reduce costs, they could share in some of the savings that they generated. That ESCO program has now migrated into a new program called the Kidney Care Choice Program, which is not just the dialysis population, but the late-stage chronic kidney disease, stage 4, stage 5. Roughly speaking, think 18 to 24 months prior to kidney failure. So it allows nephrologists and companies like Interwell to come together and do all of the follow-up, do all of the predictive analytics we've talked about, all of the care coordination necessary to help patients in late-stage CKD understand that they have the disease, and again, give them the tools, the resources, the education so that they can take better care of themselves, and the doctors can do a lot more for the patients too. But it doesn't stop at kidney failure. If a patient progresses into kidney failure, we can help them get a preemptive transplant. We can help them start dialysis at home. We can do a heck of a lot more for them, avoiding that crash that we talked about so that they can start dialysis in an outpatient setting. If you take that more holistic approach, going upstream and also identifying and working with the kidney failure population, you can do an awful lot to reduce hospitalizations across the board. That's what the Kidney Care Choice model is all about. We're the largest participant. We've got about 25 sites and at which we partner with more than 100 nephrology practices across the country. We're only entering into our second year. This is going to go through 2026, but it's a really huge step forward in, again, bringing value-based precepts and benefits to a population that otherwise wouldn't have access to them.
It sounds really intriguing, and I'll be interested to keep an eye on it going forward. Now, it's funny talking about kidney disease this whole time, and one of the things you said was that people may not even know they have it. Guess the first question I'm going to ask my PCP next visit. I'm curious about that. All right, so I had another thing to talk to you about before we closed out today's show, and that was social determinants of health. We hear so much about it. I know it's part of the new ACO REACH model. I also know that now that we're seeing it pop up as a requirement in quality performance metrics kind of across the board for providers and plans. So tell us a little bit about what you see as sort of the common social determinant factors in this kidney population and, what's Interwell doing around SDOH?
Again, another fantastic question. Unfortunately, kidney disease hits people that are among the most vulnerable in this in our society. It really hits those at the lower end of the socioeconomic spectrum disproportionately from the rest of the population. As a result, they often face many other challenges in their life, from food insecurity, housing insecurity, access to good medical care, or even just basic transportation to get around and to get to their appointments. A lack of education can also play a role. You've got diabetes and hypertension. Those are the two leading causes of kidney disease. and helping patients understand more about those conditions so they can manage them better would do an awful lot towards starting kidney disease from the outset. All of this is to say we can't just treat kidney disease. We've got to address all of these underlying issues as well. That's an awful lot to bite off. It's an awful lot to try and figure out. In a value-based world, some of the great things about that is it gives us the tools, the resources, and frees us from some regulatory constraints so we can help patients ensure that they have transportation. We can even provide it for them. We can connect them to community resources and food as medicine programs, trying to address some of the food desert issues that plagues so much of our country. So it's a really important point. And I think you said something earlier that I want to dive in on, which is, this country's been plagued by the siloization of healthcare. And if we do value-based care right, then we'll be able to break down some of those silos and not just focus on how do the specialists talk to other specialists, but also how do we provide and how do we talk to and engage all of this fabric of social programs that are across the country. That's what's going to help us solve the social determinants of health problem. So here at Interwell, we've launched a new corporate social responsibility program. We're going to identify ways to advocate for early screening of kidney disease to help our population. We're going to address issues of health equity because, again, it impacts our population so disproportionately. So that's what we're focused on in our little corner of the world. But it's a massive undertaking, not just for kidney disease, but clearly for society at large.
Absolutely. I'll go back to my Uncle Jack, right? I mentioned when he's from New York City. And when he would come visit me, I was the one who would take him to dialysis, but he didn't drive, so the whole transportation thing with dialysis is just urgent. It's not optional. I mean, you need to be there when you need to be there. Yeah,
it's exactly right. And you've got these patients who have to go see their nephrologist. If they're on dialysis, they have to go to the dialysis clinic. They have to go to see their primary care physician. They probably have to go to a cardiologist, almost certainly the endocrinologist to deal with their diabetes. They're bouncing around from appointment to appointment and specialist to specialist. And again, this dialysis is grueling, as your Uncle Jack obviously experienced. And any help that they can get from folks like Interwell is a huge help because it's such a burden on the families as well, as you unfortunately know.
Yeah, absolutely. Absolutely. So we do have a few more minutes. Is there anything else we haven't covered or anything else you want to share with our audience?
Absolutely. I mean, I guess at the end of the day, this sounds odd, but healthcare is hard. It's really messy. And there's no panacea other than hard work and making sure clinicians have the information they can pass on to patients where and when they need it most. It's all about, again, as we talked about earlier, providing that insight at the point of care. So I love being able to talk to you about how we're innovating in data, technology, and care models, what we're doing differently with physicians, trying to engage them and their support staff differently and giving them the data and analytics that they need. At the end of the day, what we're trying to do is help the docs do all of the follow-up that they know they need to do. They say they do, but unfortunately, as we all know, don't have either the time or the resources to be able to do it. So for us, again, at the risk of sounding like a cliche, we try and focus on those cookie problems. It's how we've been able to keep patients healthy at home. It's how we've been able to reduce all-cause hospitalizations by 20%. But it's just about really rolling up your sleeves, making sure you've got mission-driven, dedicated individuals who want to do, every morning wake up with the notion of how can I help my kidney patients live their best lives? That's what's going to drive success. And so far, it's been great for us.
So changing that kind of takes us back to the changing patient behavior conversation, right? I'm just curious, do you see going forward, like I'm the last of the baby boomers, right? And then I see the generation behind me. Like, do you think that because we have many more people ahead of us, patients that are digital natives, they're very familiar with looking at data, they trust data, they seek data. Do you think it's going to be easier going forward to change patient behavior? And this is just in general, not necessarily even the 2 cookie problem or the 4 cookie problem.
I think you might be right, and I hope you might be right. I certainly hope you're right. We've got an awful lot of technology at our fingertips now that we didn't have 20 years ago, let alone 20 months ago. It's really exciting to see everything that we're able to do in the financial setting, in the social media setting, and you've got to think that that's going to translate over into healthcare. The challenge that I see anyway from our little corner of the world is that kidney disease, incident rates continue kind of unabated. The dialysis population grows at 3, 4, 5% a year, almost like clockwork. And if you look at the upstream causes, again, hypertension, diabetes, they're still there. We still eat too many Big Macs as a nation. We still eat too many sweets as a nation. And I don't mean to make this all about just what you choose to eat, because there are obviously all kinds of other factors that go on, genetic and otherwise. But it's, patient behavior is, if it's going to change, and I think you're right, it could, it's just that long, slow arc. But one of the things I'm so excited about, we take care of 125,000 patients today. Even incremental changes on a very large population can yield unbelievable results. Yeah, on cost of care, but also in the health of the overall population. So again, it's that long, slow slog. You got to stay at it each and every day.
We'll conclude by me asking sort of maybe a sensitive question. Competitors. Do you guys have any competitors?
We do. Actually, it's kind of an exciting time in kidney care. For about 50 years, this has been a pretty sleepy outpost of healthcare where it's only focused on dialysis, and you had dialysis providers, but nothing else. And I think for a long time, there were a lot of us in the industry, myself included, who were crying out for a way to innovate it. Value-based care, these alternative payment models, has really been the harbinger of that change. And what we've seen in the last, call it 3-4 years, is a huge influx of investment in this space to the tune of about $2 billion of private equity and venture capital to try and start models that are kind of trying to get to the same endpoint. Again, engage patients early, take full risk, and see if we can change their behavior. So there's an awful lot of competitors. We're all starting from very different starting points. We've really focused on partnering with nephrologists, being their partner and empowering them to do more. Others are building different models. I was at a startup called Cricket, which is now part of Interwell. We took a very unabashed technology-centric approach. So there's a lot going on. There's a lot of innovation, which hopefully is going to yield some pretty impressive results in the future. But we got to let it play out.
Exactly. Innovation is what it's all about, and it's exciting to see the bringing together of the companies and all the different pieces and components of kidney care, which you guys are doing so well. So congratulations on that. Congratulations on your 1-year anniversary. And I just wanted to check to make sure that the easiest way to reach you is on LinkedIn or the company website, correct?
That is correct. You can find us there.
Thank you so much for being on Finn Voices today and talking about innovations in kidney care management, but almost more importantly, in disease prevention. So thank you.
Beth, thank you for having me. I really enjoyed it.
This has been Beth Friedman, Senior Partner at Finn Partners. Thank you for listening to Finn Voices on Healthcare Now Radio, where we talk about health information, health innovation, and all the technology in between. Until next time, wishing you all the best in health.
Finn Voices is brought to you by Finn Partners, a global marketing and communications agency working across industries and services. Whether inside our walls or on the front lines of health transformation, we stand together to create meaningful and measurable impact in the world around us. Learn more at finnpartners.com and follow us on Twitter @FinnPartners.